Balantidium coli is a type of bacteria that is found inside the intestine of the human body when infected. They specifically infect the cecum and the large intestine. Balantidium coli is the only ciliate protozoan or parasite of humans and is the largest protozoan that resides in the human body, causing a particular disease called balantidiasis. Balantidium coli infection can be acquired through drinking water or eating foods contaminated with feces that contains the cyst of Balantidium coli. The transmission of Balantidium coli is zoonosis, meaning it is from a non-human to a human being. If a healthy human being is infected, it does not feel any symptoms of the infection, because the symptoms occur only due to lower resistance of the human body.
What's your first reaction when you hear the word parasite?
Oh, hell no!
Yes, that's exactly it. And so today, let's talk about a parasitic organism called Balantidium coli. Although humankind has been fighting for these parasites for 100 of years since its discovery on 1857, we cannot still get rid of them completely. So why are these little bees so tenacious? More importantly, are there any ways to defeat them? Surprisingly, yes, there are. If you want to know more, then please keep on watching. Let's start with the basic, shall we? So what exactly is Balantidium coli? Balantidium coli is a parasitic species of ciliate alveolates that causes the disease Balantidiasis. It belongs to the group of protozoans called ciliates because of the presence of hair-like organelles called cilia. This is known for being the largest protozoan parasite of humans. Transmission of Balantidiasis. The host most often acquires the cyst through ingestion of contaminated food or water.
So most people with balantidiasis are asymptomatic or present mild symptoms. Some individuals may become acutely ill diarrhea, dysentery, nausea or vomiting, foul breath, colitis, abdominal pain, weight loss, deep intestinal ulcerations, and possibly perforation of the intestine. So balantidiasis is a rare infectious disease caused by the single-celled protozoan parasite Balantidium coli. This parasite may be passed directly to humans by contact with pig feces or indirectly by drinking contaminated water.
We're going to talk about a really common infection called Balantidiasis. It's caused by Balantidium coli, and it's really common in our country, Mexico. Okay, let's start. Okay, our general data. The tropical countries are really vulnerable to this disease. Balantidium coli is the biggest protozoa and the only one with a cilium that causes a disease to the humans.
Poor nutrition, a compromised immune system, or other illnesses may make a person vulnerable to more severe symptoms of this disease.
Okay, our clinical picture will be really general. We have dysentery syndrome, fever, and abdominal pain. And you know that this clinical picture can be caused by a lot of viral infections and other stuff that we're going to see in the diagnosis.
Risky people are those living in some areas of Brazil, New Guinea, Africa, and southern Iran. Luckily, there's a test for Balantidium coli infection. Yes, you've heard it right. Stool samples can be examined by laboratory microscopic examination can be detect Balantidium coli in the stool. This can only be transmitted by fecal or oral route. Prevention requires definitely not only personal hygiene, but also community hygiene because it helps prevent the spread of the said disease since transmission occurs through ingestion of contaminated food and water.
Hygiene is a set of practices to follow to maintain good health and prevent disease. Hygiene maintenance includes maintaining cleanliness, eating good food, and maintaining one's surroundings. By maintaining hygiene, we can prevent both communicable and non-communicable diseases. Let's discuss their prevention in detail. Prevention of communicable diseases by hygiene maintenance. Pathogens or disease-causing microbes are a major cause of communicable diseases. They decompose organic materials such as food items, meat, plant, human excreta, etc. and multiply in numbers. They can reach to us through food, air, and carriers such as housefly, mosquito, etc. Most of the pathogens flourish in our surrounding because of poor cleanliness. By keeping surrounding clean, we can prevent most of the communicable diseases.
Do not use human feces as fertilizers in agriculture. The use of this is a risky practice as it may contain disease-causing pathogens. Feces must be disposed of properly.
Wash your hands after going to the toilet and before meal. It is the best, simple, and effective method of preventing infections.
Step 1. Wet your hands and apply soap. Step 2. Rub your palms together. Step 3. Rub the back of your hands with your palms. First the right one, and then the left one. Step 4. Interlock your fingers and rub your hands well. Step 5. Cup your fingers and rub your cupped palm with the opposite hand. Then swap. Step 6. Enclose your left hand with your right thumb and rub well. Then swap. Step 7. Rub the tip of your fingers over your left palm and then swap. This way, we clean away dirt that may have been left under your fingernails. Step 8. Rub around your wrist with the opposite hand. Then swap. Step 9. Rinse soap off your hands. Step 10, the last one. Dry your hands with a clean, dry towel.
Only drink pure water. Filter or boil the water to purify it to avoid diseases such as diarrhea, cholera, and more. Handle the foods properly by washing the vegetables and cook the meat properly. Unwashed vegetables contains bacteria that can harm our body and same as the meat. Decreasing exposure to pig or pig excrement will reduce the risk of infection.
Some basic safety precautions to take when you've got lots of people and lots of food in one place. Avoid cross-contamination. Separate your ready-to-eat foods from your raw foods. Use separate cutting boards for your raw meat and your raw vegetables. Clean your utensils and cutting boards before you reuse them for different types of food. Keep hot foods hot and cold foods cold when you're moving them or keeping them on a buffet. Leftover food should be cooled as quickly as possible. Don't leave them sitting on the counter or table to cool. Never thaw foods on a counter at room temperature. Germs will grow faster that way. Here are 3 methods for safe thawing. Under running water, 70 degrees Fahrenheit or below for less than 2 hours. In a refrigerator at 41 degrees Fahrenheit or below, or in the microwave as part of the cooking process.
The cysts remain viable in feces for a day or 2 and may contaminate food and water. Thus, it is transmitted to other human or animals. Infective Balantidium coli cysts are killed by heat.
Is there treatment? Yes. The 3 medications often used to treat Balantidium coli are the tetracycline, metronidazole, and iodoquinol. See your healthcare provider for treatment. Asymptomatic carriers should be treated with antibiotics along with the symptomatic patients. Asymptomatic carriers still release infective cysts in their feces, and treating these individuals helps to halt further transmission of the protozoa.